Now, the province continues to deal with a growing number of COVID-19 cases connected to long-term care homes. Cynthia Mulligan has been following this story for us. Cynthia.
Well, Melissa, I can tell you some new news. Premier Doug Ford is promising new modeling numbers on Monday. The last projections released 2 weeks ago today predicted cases being much higher than have actually materialized. For example, 1,200 patients were projected to be in ICU by today, when in fact there are 245. So it will be very interesting to see what impact the last 2 weeks of social distancing have had on the new projections. Now, long-term care, as you mentioned, is still a big concern. Patients here make up about 13% of all provincial cases. 216 have died, but staff are also at risk.
I want to personally thank everyone working around the clock at our long-term care homes, retirement homes, and group homes across the province. You're my heroes. You are the protectors of the most vulnerable. Thank you from the bottom of my heart.
The perils of working in long-term care hit home today, though, with the death of the first personal support worker in Ontario. Christine Mendegarian worked in the Sienna Altamont Care community. She had been a PSW for 31 years. So far, 621 workers have tested positive for COVID-19, as well as at least 1,229 residents. Now, a massive issue has been protective equipment for workers. And I want to tell you about a conversation I had today with a PSW, a personal support worker, who worked for an agency. Now, he's afraid he's going to lose his job, so I'm protecting his identity. But I have verified who he is through one of his clients. He tells me he was sent into a long-term care home, but he quit when he was recently told not to wear a mask, even though residents were coughing. Now, this PSW says to me it's, quote, like sending a soldier with a gun and no bullets. We need PPE to fight this crazy, insane virus. Now, 2 days ago, the Ontario Nurses Association called for immediate access to PPE for long-term care workers. It's something the government is promising to be working on. The PSW is currently working for a second agency that sends him to up to 8 different homes a day, working with elderly clients. And he tells me he's only been given 10 masks to last 1 month. I asked the Associate Medical Officer of Health whether she thought that was sufficient.
The issue to date has been that with the limited supply of PPE, it has been prioritized to acute care and now to long-term care and retirement homes. I think obviously 10 masks for a whole month is not very good.
There are currently 829 people in hospital with COVID-19. Over the past couple of days, we've been calling hospitals to see how many patients they have treated or are currently treating to get a snapshot of where they are. And what you're looking at now is where all the current patients are being hospitalized. And in the east, Michael Garron Hospital has treated 189 patients, far more than Sunnybrook or St. Mike's to date. West of the city, William Osler, which is Etobicoke General, and Brampton Civic have treated 751 COVID-19 patients. Trillium, which is Queensway, Mississauga, and Credit Valley, has treated 624. UHN, which represents Toronto General and Toronto Western, could not provide us with those numbers, but there are at least 63 patients there right now. And the Associate Medical Officer of Health says things are generally looking better, but cases are still going up, and we are not out of the woods. Premier Doug Ford appealed to everyone to practice social distancing this weekend, especially as it is supposed to get warmer.